This episode series is sponsored by the Grand Prairie Chamber of Commerce. The Faces of Grand Prairie is a proud member of the Chamber. For more than 9 decades, the Chamber has been an essential part of the fabric of Grand Prairie, advocating for our business community, supporting growth, and helping local businesses thrive. Information on joining the Chamber of Commerce can be found in the description below.
All right, hey guys, how's it going? Welcome to the Grand Prairie Chamber Taking Care of Business segment. You guys are actually a guest that we've been kind of trying to connect with for a little bit. We wanted to kind of get some information from you guys about the hospital and all the amazing work that you guys do. But before we get to that, I would like to bring on my co-host right here, Mr. Brian Bundy, CEO and president of the Chamber. How's it going, sir?
Kevin, it is always a pleasure to sit next to you here in the podcast studios. The studio audience is large as usual. It's nice to have people around. That is, they're just walking around.
Right.
But we're especially glad to have our guests from Texas Health Memorial Arlington Hospital here with us in the studio.
Absolutely.
Back to you.
Absolutely. So, guys, go on and introduce yourselves before we get into the meat and potatoes of this session.
Well, great. And thanks so much for having us. My name is Dr. Ken Rothfield, and I'm the Chief Medical Officer at Texas Health Arlington Memorial Hospital, and I've been in that role for a little over 5 years.
Hi, I'm Vicki Popplewell. I work with the president of Texas Health Arlington Memorial Hospital, and I've been there for 18 years.
Wow.
Fantastic.
So you got some good tenure there, man. So what do you guys like most about the hospital? You guys have been representing there for a while, obviously loving the work that you're doing. What do you love most about the work that you guys do there?
Well, there are two things that I love. Number one, I love the people at this hospital. I'm an anesthesiologist by training, and I practiced in that field for about 21 years, really all over the country, before I got involved in patient safety about 12, 15 years ago and decided to devote the rest of my career to that. And as a chief medical officer, I've been doing that for 11 years now. I spent 3 years with America's largest not-for-profit system. Then I was with America's largest for-profit system for another 3 years until I was recruited by America's best system, which is Texas Health, a little over 5 years ago. And the remarkable thing about Texas Health as a system is the culture. We're incredibly focused on quality and patient safety. It really is everything that we do, and all of our decisions are informed by that. But even beyond that, it's the culture of the people. We have an incredible culture of collaboration and respect. I have to tell you, I like every person who works at my hospital, and there are thousands of people there. And I don't know that I've ever said that before, but we have a wonderful group of people. We have employees that stay for decades because of the environment, and it makes it real easy to do my job when we work with such terrific people who are there for the right reasons. And just another factoid that we're really proud of, recently in Fortune magazine, we were named the #1 place to work in healthcare in the country.
Oh, wow.
So Texas Health is really doing things right. And Arlington is a very special place. We've been around since the late 50s. The community built the hospital. Everybody in Arlington was asked to contribute 25 cents to build the place. When Arlington Memorial became part of Texas Health, there was a lot of interest in maintaining the word Arlington Memorial as a link to the community and where it came from. That's why we're the only memorial in the Texas Health system. We have 14 wholly owned hospitals. We're the only memorial really back to our Arlington community roots. So it's a remarkable place, and I'm really proud to show up there for work every day.
Wow. That's not many people can say that, but how about you, Vicki? What do you love most about it?
I think it's the people and the culture. Everything he said is correct. It's just a great place to work.
Yeah. Wow. Well, I'll tell you this. We don't have a hospital in Grand Prairie, and I think that's one of the things that a lot of people, kind of pleaded for. But every time something happens, because the way that Grand Prairie is kind of long, we're not wide. It's like as soon as we call someone, there's really all the different hospitals that's all around Grand Prairie to that kind of puts us in a place where we don't really have or a need for a hospital like most people would think we do. But you guys are, man, a pretty one that's, I know a lot of people that I've talked to that visit that hospital many times, and the amazing work that you guys do there is kind of felt by the patients and the people that check into the hospital. So you're doing some amazing work. So it just kind of leads off of the people loving what they do. it's kind of resonating to the people who actually go there to visit you guys. So keep up the great work, man. Awesome job. So tell me this, in your field, could you say your title there is kind of,
I'm the Chief Quality and Medical Officer.
Yeah, give me a little bit more in details of what your day-to-day looks like from your position.
Sure. Well, as the Chief Quality and Medical Officer, in some places call it the Chief Medical Officer, it's the same thing. My job is really to make sure that everybody there is making sure that we're keeping our promise to patients by doing our best and doing everything we can to address patients for whatever phase of life they're in and whatever brings us to the hospital, which means I work with a bunch of very talented people who work in patient safety, quality, our medical staff office that make sure all of our doctors have the appropriate credentials and are the kind of doctors we want to have working in our hospital. I work with our care transition management team. Those are our caseworkers and social workers who look at every patient in the hospital to make sure that they're going to the right destination in a safe place after we're through taking care of them. And I also work with our infection prevention team. Hospital-acquired infections are a big deal, and we want to make sure that nobody ever gets an infection because they were in the hospital for something else. So we have a team of 3 very talented people to make sure the environment of the hospital is clean and safe for our visitors, patients, and our staff. So really, I work with just about everybody, and I work very closely, of course, with our doctors of every specialty, and I'm there to help provide perspective and a resource to help them take their best care of our patients.
I love it. How about your day-to-day, Vic?
Well, I work with all of the executives in the office, so I do a little bit of everything, but mainly just keeping everybody where they need to be at the right time.
Yeah, Vicki is understating her role. She actually runs the hospital.
A fine orchestra
I
leader.
get told
indeed,
that
right?
a lot.
I can see that. But tell me this: what can a family expect? Family in critical situations, right? If a family has to check into the hospital, what type of service? What can they expect if they're visiting your facility?
Well, we're really a full-service hospital, and we really like to think of ourselves as Grand Prairie's hospital. And everything that we do as an organization is really around our promise statement, which is individuals caring for individuals together. It's really the way we meet people where they are. It's the way we work as a team. And so for anybody coming to the hospital for either something that's a critical situation or even what we might think of as a minor situation, it's always a big deal for the patients and families.
Yeah.
If you're having an operation on your thumb, it's just as serious as having a heart attack. So we try to consider that for every patient that comes through our doors, and we provide the full range of hospital services. Now, we also have a heart hospital, which is physically connected. It's under a roof. It's actually a separately licensed hospital. But in our location in Texas Health Arlington in North Arlington, we can really take care of virtually any problem. There are some very specialized things where we might transfer to one of our sister hospitals in Dallas or Fort Worth, but that's a very short list. So for folks showing up with a major problem, we are a trauma center. We're designated as a level 3 trauma center. We just had a redesignation by the American College of Surgeons, which was a very rigorous process to ensure that we're meeting the highest levels of patient safety and quality. So that just happened a couple of weeks ago. In addition to being a trauma center, we offer a lot of other advanced services. We're a primary stroke center. So for somebody showing up with stroke-like symptoms, we're able to care for them on the spot. And in the next couple of months, we're going to be certified as something called thrombectomy capable, which is the next level, which means if somebody has a blood clot in a vessel that needs to be removed, we can actually remove that percutaneously in a minimally invasive fashion right there in the hospital. Currently, patients showing up with that subset of stroke symptoms, after we make the diagnosis, we need to move them to another facility, but we'll be adding that so we can take care of that on the spot as well. But in addition to the really critical services, we also offer very common services like orthopedics and sports medicine. People love sports in Texas, and we have a team of doctors that are able to take care of all those sports medicine needs. And we also have 2 clinics, one in Cedar Hill and one in South Arlington for outpatient sports medicine as well. So we really want to be able to support patients and families in the area, and especially in Grand Prairie, by offering the full suite of services.
So I'm curious, the stroke capabilities.
Mm-hmm.
I understand that there's now a medicine that can be administered to somebody within a certain period of time that can actually help reverse the symptoms of the stroke. Is that something that your hospital handles as well?
Yeah, absolutely. And that's what a primary stroke center does. So if you show up with neurologic symptoms, weakness in an extremity, confusion, maybe your face is drooping, or other stroke symptoms, we have 24-hour availability of a neurologist from the emergency room. And if somebody comes in with those symptoms, we activate a stroke alert. And that's all hands on deck to diagnose and treat the problem, which means getting a CT scan of the brain immediately to make sure there's no bleeding. And if the indications are all correct, we're able to administer one of those clot busters, and those will typically melt those clots away and restore patients to their normal state of health. So that's really important, and it's one of the most important things we do. And we beat every national benchmark for how quickly, when a patient comes through the door, how quickly they're getting that medication. And we typically outperform national standards on that. So it's something we take very seriously. Adding thrombectomy capable is the next step for us to be able to take care of everything right on the spot at Arlington Memorial.
Wow.
Love this very much.
Absolutely.
Hey guys, this is Kevin with the Grand Prairie Chamber, man. Thank you guys for watching this episode. We want to take a quick second to kind of let you know, like, if you would like to become a member of the Grand Prairie Chamber of Commerce, guys, it's pretty simple. Just go to our website. It's pretty simple, grandprairiechamber.org, and look in the right-hand corner, it says Join Now. Pretty simple, man. You can become a member, just like all these other amazing members that we're interviewing. You can become a member as well. You want to give me a call? You got questions? Give me a call at 972-264-1558. And you could become a member of your local Grand Prairie Chamber of Commerce.
What are some of the other symptoms, real quick, if someone who may not even know that, hey, I'm experiencing these things, but I don't know what it is? Because I know sometimes you can have a stroke and don't even know it. So what are some of the symptoms that people can look for in terms of maybe the top 4 or 5 symptoms for a stroke?
The classic ones are weakness in an extremity, drooping in your face, trouble speaking. Sometimes it can be confusion or trouble thinking, or other imbalance or unsteadiness. So if any of those things are happening, what you want to do is get to the hospital and be checked out in the emergency room.
I like it. So I understand that there's some updates coming for the women or family situations, right? Something like that I think that I read. Here it says Women's and Family Services. Is some updates coming to that?
We're doing some major renovations to the building. We've been there since the late 50s. We have a lot of additions to the core building that was built way back when, but some of our areas are really in need of a makeover. We've just completed a huge renovation of our breast center, which now is a spa-like atmosphere. It's absolutely beautiful. You'd never know you were in a hospital facility. And that's our breast imaging center, which offers a really nice environment in addition to access to our terrific medical staff, doctors and nurses. We're doing the same thing now for our labor and delivery unit. So if you're coming in to have a baby, first quarter 2026, we're going to complete that multi-million-dollar renovation, and it will be the same beautiful spa-like atmosphere we've created with our breast center. And we're also renovating our neonatal intensive care unit. So that gives us not only the right doctors and nurses, but a state-of-the-art environment as well.
Wow. I was another situation I was talking to. That's pretty amazing, by the way. I was talking to Vicky about cancer and just kind of asking you guys about treatments and different things. You guys have any centers that kind of gear toward cancer? What are some of the resources you guys provide for cancer patients?
We have a really close relationship with our oncology team, and their offices are just a couple of buildings over. So we work with many very talented oncologists. We have a specialized oncology floor, so patients there are getting care that really is focused on patients working through cancer, and our staff is able to support them in every way, not only medically, but emotionally and spiritually as well. And that's with our chaplain team as well. And we're also able to provide some really advanced cancer treatments. One thing that we're very proud of, which is new over the past couple of years, is we've added robotic technology to biopsy lung masses. So sometimes patients will come to the hospital, they get a chest x-ray or a CT scan, and they wind up with an incidental spot on their lung. It wasn't causing a problem. It was diagnosed accidentally. Well, imaging was done for some other situation. We actually keep track of everybody having imaging in the hospital. We use an artificial intelligence tool to find those patients who have an incidental finding that's not related to the reason that they're in hospital. We have a coordinator who reaches out to them to make sure that they know that that finding was there, to follow up with their doctor, but we also refer to our pulmonology team. And we have one particular pulmonologist, his name is Dr. Tony Sue, he's been with us for decades, and he uses a robotic system that's able to do a biopsy just through the skin of tiny lung nodules that are just maybe less than a centimeter, teensy weensy lung nodules, which typically were not biopsyable before. So back in the day, if you had one of those, you just follow it every year, see if it was growing, and if it got big enough, you do something about it. Because we're able to get a biopsy when they're still very early, we're able to figure out what it's made of, if it's worrisome, and if we have to do anything about it. And frequently, those tiny lung nodules, if they are cancer, can be removed also with robotic, minimally invasive surgery, and make the diagnosis much earlier at an earlier stage, and in many cases, cure the patient on the spot without having either a bigger operation or needing more work. Many of our patients also, they wind up seeing our oncologists. Some patients will need radiation or chemotherapy or other things, but by catching lung cancers at the earliest stage, we have an opportunity to save a lot of lives.
Man, AI, the technology is advancing so fast right now with everything with AI. How much do you see AI coming more into the daily processes of what you guys do in the hospital? AI seems like it's everywhere. I'm pretty sure in the hospital is kind of making its mark as well. Do you see it kind of integrating more into the hospital right now?
Absolutely, and already has. And we want to be really judicious in how we're using AI. The technology is exploding, and you are absolutely right. It's going to be a bigger and bigger part of everything we do, virtually in every field. The ways that we're using AI right now at Arlington, I mentioned we're using robotic technology, as well as using AI technology in our emergency room. Our doctors have access to AI tools to help them speed up the way they document visits with patients. So it's not replacing what our doctors do. It's not replacing the way they think, but it's making them more efficient and making it easier to have accurate charting that goes in the medical record and helps them take care of patients more quickly. So if you're in the emergency room, the first thing you want to do when you get there is go home. And by using that technology, it makes it a lot quicker for our patients to have their visit in the emergency room and then head back to their homes. It's also used very extensively in radiology. So in any field where you're looking at patterns, AI is really good at pattern recognition. So our radiologists are using AI tools to make sure that the diagnoses are correct. In the end, it's our doctors who are making the diagnosis, but there are AI tools that can help them work more quickly and efficiently because our physicians are working at a breakneck pace of looking at thousands and thousands of images. That's something that's really changed in the course of my career. Back when I was a kid, as an intern, the MRI scanner was a brand new thing. CT scans were relatively new, and we weren't getting images on everybody. But now, between CT, MRI, PET scanning, ultrasound, imaging is one of the most important things we do. And being able to work through a massive volume of images accurately is a way that AI can help us be more effective.
AI is taking over. Wow. And they say it, it's something that we need to embrace, rather than fear, because it's here, and it's the best way to look at AI is how can I use it, as opposed to fearing it, right? I'm being scared of it, but how can I use it into my everyday living or job or whatever, so we can help us to do things more efficient. So AI is amazing so far, from what I hear.
It is, and I think we all really welcome the advent of AI if we use it properly, but it has a lot of promise to save lives because, as I mentioned earlier, AI is really good at detecting patterns or taking a lot of information and thinking about it very quickly and making a determination.
Yeah.
And I think one of the things I'm really excited about are using AI tools, which will be, in our hands in the next year or two, that will predict what patients are maybe going to get sicker that we need to focus in on. And if we can focus in earlier, maybe we can provide treatment that will prevent them from progressing and allow us to turn things around quicker. So by detecting subtle variations in vital signs or lab studies and putting everything together in a way that you really would need a computer to do. So I'm not afraid about AI in healthcare at all. I think it's just going to make us better and save lives.
Yeah, absolutely. So let's switch. Let's turn the page a little bit. We're in an active community, right? People are very active, doing a lot of things. We're at the amazing Epic right now, right, where people are very active. How are you guys helping that industry? I guess have injuries, or just do you have something that's dedicated to sports injuries, trauma, or anything like that at the hospital as well?
You bet. So our sports medicine team is comprised of orthopedic surgeons as well as our trauma doctors, because some patients who are injured playing sports, it's really sometimes more than just a simple bone injury. It could be a traumatic injury. So having a level 3 trauma center where we can comprehensively look at patients' injuries, not just from the orthopedic perspective, but from the whole body trauma perspective. But for just routine sports medicine, we have a team of doctors to do that, who specialize in sports medicine, foot and ankle, joint replacement, orthopedics, and we're very well supported by that team. And as I mentioned earlier, we also have an outpatient presence here in Cedar Hill and in South Arlington, where our doctors run a sports medicine clinic as well, because some of these injuries really just need follow-up in an outpatient setting, and we're able to provide that.
That's good to know, because I know after this interview, me and Mr. Brian, we're going to do some one-on-one on the basketball court, and I may dunk on him. So if I tweak his ankle or my ankle, I need somewhere to go for that sports injury.
And this Dream Minute has been brought to you by.
We do have a coupon in the paper for Achilles tendon repair.
Hey,
Buy one, get one, huh?
Hey, Doc, I do have some Achilles tendon issues right now. Are you serious about that? I have. Don't start with my Achilles.
We don't have a coupon, but we'll hook you up.
Okay. Well, good deal, man. Good deal.
Let me ask you a question, kind of changing the tone a little bit. We live in a very competitive marketplace. DFW is one of the top marketplaces for healthcare. How is it from y'all's perspective, recruiting talent and retaining talent? Because the demand is so significant.
Yeah, that is always a challenge, and especially in the physician market, because we're really underserved as a country by physicians, and we want to be a place that makes it easy for doctors to do their best work. And one of the ways we do that, as I mentioned earlier, is the culture. We have an incredibly collaborative environment, and our physicians feel very well supported by the rest of the hospital. Our nurses, our technicians, all of our ancillary services are really standing behind those doctors to enable them to do their best work. So in terms of recruitment, we've been very successful in getting people not only to come on board, but to stay with us by providing an environment that is very high quality. So if you're a doctor and you're doing surgery, those nurses are going to be with the patient for 24 hours a day, even though you might just stop in for 5 or 10 minutes a day. And for our physicians to feel comfortable, the patients are getting the best, safest, most compassionate care. And that's really been our hook. It's been our culture, where we get physicians who want to come practice at our hospital, but they see that their patients are getting superior care and having a great experience. And in terms of retaining our hospital staff, nurses are also in shortage, and technicians all across the board. So we provide an environment that is supportive, friendly. It starts with us picking the right people. So not just everybody can come to work at Texas South Arlington Memorial. We hire for fit, make sure they're people who are going to thrive, who are going to feel supported. And because of that, we have incredibly low turnover. People stay for decades. And frequently we get outstanding people from our competitors for one reason or another. They weren't happy working with our competitors, and they're outstanding, and they come on board with us, and we keep them for the rest of their career. So I'm really proud of our ability to attract and retain talent, and the proof is in our numbers. Our turnover is incredibly low. And finally, even Forbes magazine said we were the best place to work in healthcare. So I think we're doing a lot of things right.
Very good.
And I will brag about my boss, because it does start at the top. Vicki works for Blake Kretz, our president, who probably would be here today instead of me if he didn't have another engagement out of the city. And Blake is a person of impeccable character. I've said that many times. But when you have a hospital where the president is an approachable, principled person, everything works really well from there. And one of the things I like best about my job, we don't have any friction with our doctors. Frequently in hospitals, there can be a lot of town versus gown, the doctors versus the administration, and we have none of it. We work really well with our doctors because they know that we're in their corner, because our goal is just to make sure our patients are getting the best care, and we're making it as easy as possible for our doctors and the rest of our staff to do their jobs.
Thanks. Very good.
I like it.
Yeah.
So you have an amazing president, right? It starts with the leadership, right? You have amazing culture, all the amazing things, all the people that's there, and the things you guys implement. Another thing that I know for sure is that your surgical innovation, the way that you guys doing things from a surgical perspective. What makes that procedure and the way that you guys look at surgery and things that you guys are doing? What makes your program stand out?
Well, again, it comes down to the people that we attract and retain. We have one of the busiest robotic surgeons in the country working with us doing general surgery with the Da Vinci robot platform. And that robotic technology is used by not only our general surgeons, but our OBGYNs as well. And we also have very advanced imaging to support our neurosurgeons. Not every hospital has a brain surgeon. They frequently have spine surgeons. And we have a neurosurgery team that does all that work, including very advanced brain tumor surgery. And we support them with very advanced imaging, navigation. We even have a CT scanner in an operating room, so we can actually perform a CT scan during an operation. So that is how we get it done. We continue to maintain the leading edge of technology and then attract the physicians who are able to use that maximally.
I like it. What do you think about that, Vic?
It's pretty cool.
No, I'm not saying you should run out there and have brain surgery. But if you needed to, we can take care of you.
Well, what's the future, man? What is the future for the hospital and all the amazing things you guys are already doing, the innovation of surgery, stroke, cancer? You guys are, AI implementations, everything, some of the stuff you guys are doing. What's next for the hospital? What are you guys looking to do? Anything major that you're looking to start implementing, to start any type of programming that you're going to start to implement into what you guys do?
I think it's really important for us to continue to grow as a trauma center because there's a lot of competition around the Metroplex, and we'd like to be able to take care of even more patients who've been injured in the community. So that's something we're looking at. We haven't made any distinct plans, but we would like to expand the depth and the breadth of our trauma program. We also continue to expand our vascular surgery team as well, and just maintain the cutting edge in terms of technology, because if we don't have all the technological assets at the hospital, it's hard to retain top talent. And for more routine things, we work very closely with a group of hospitalists. Those are the internal medicine doctors who are taking care of almost all of our patients in concert with our specialists. Maintaining a robust hospitalist team that's taking care of our patients has been very important to us. And also just meeting the needs of the community. And I think that's one of the greatest challenges. We take care of a lot of people in the community who have very tough life circumstances. They don't have a lot of resources. Sometimes they don't have insurance, and we have to be there for everybody. So finding ways to meet people where they are, support people through the toughest times of their life, and find them the resources. And that will always be a challenge for us, but that's one that we take on willingly because that's part of our mission.
Yeah.
I feel like hospitals kind of get caught in the middle of the whole insurance debate because a lot of times insurance companies are going to dictate what they're willing to pay, even though the hospital is right there with boots on the ground, doctors in the room. How can you navigate this particular challenging time with insurance companies and still be competitive and strong?
Well, it definitely is a challenge, but when patients show up at our door, we're going to take care of them. And there's no different standard of care for somebody who has insurance versus somebody who's uninsured. We do the best for everybody who comes through. And the tricky part is when patients don't have a place to go and they don't have funding to do it. And that's where our case managers and social workers come in. And we'll have patients in the hospital for quite a while we work on finding them a destination. And we always get there, but sometimes it's really challenging.
Yeah, good point. Thanks.
Yeah. Vicky, what do you like about this young man here most? And I know it's probably putting you on the spot, but he gave you some props and say how awesome you are, but also, how do you feel about your staff as a whole, and specifically, right, Mr. Raphael right here, and the work that they're doing?
Well, they're just all so smart. They know, what to do and where to be and who to talk to, and they are just on top of everything. And Dr. Rothfield is exceptional with our physicians, so we're very proud of him. The president, he's wonderful. I mean, we just have a real group of people, great group of people. Our chief nursing officer, she does a really good job. Her name is Shauna Bracco. We just have a great staff that does everything, a little bit of everything.
So if someone wanted to, be a part of this amazing staff and culture that you guys speak about, how can someone, what are there any positions that you guys typically normally hiring for? Because it may be somebody out there who would love to be a part of that culture and everything that you guys got going on.
I would say look at the Texas Health website, and we have a whole section devoted for people looking for employment, not only at Arlington but across the system. So there are always jobs available, and we hire very carefully. So we're very selective, and I think that pays off in terms of the quality of the care that we provide to our patients. But I would encourage anybody who's looking at a career in healthcare to see what's available at Texas Health, because you're not going to find a better employer.
Wow, I love it. How about community work? Do you guys do anything in community initiatives that you guys are doing that the hospital does in terms of give back or anything like that?
We do a lot of stuff with Arlington ISD. We do a lot of stuff with both chambers. What else?
Several things. We sponsor a lot of events at the Levitt and other events around town. And we have a very close relationship with Spear Elementary School, which is basically across from the very front of the hospital. And we support those kids. And many of them really benefit from our relationship because we're able to provide some resources that sometimes they're challenged. Just before school started, I think Vicki and the rest of the team and I rolled multiple carts full of stocked backpacks with school supplies for the kids there. I think we provided over 200 backpacks for the kids. And so it means a lot to them. And we like to put fun things together for them as well, including having Santa come over for a visit with Santa. And that is the husband of our chief nursing officer, who's been conscripted into the Santa role. But I think he really digs it, actually. So we find a lot of opportunities to give back to the community.
I love it.
Yeah, we do a lot with UTA also.
Correct.
Yeah.
Nice. So looking ahead, what are some of your primary challenges with regards to medicine in general or operations or any of those other areas?
I think, we mentioned a little bit about payments and insurance. That's a moving target, and that will always be an issue. But finding ways to meet the needs of our patients and help with chronic diseases, I think that's the next step for us is having more and more preventative care. We like the fact that we can intervene when patients are critically ill, but the real goal is to keep people out of the hospital and keep them healthy. And as a system, Texas Health is really set up to do that because we're not just hospitals. We have a presence in outpatient care, primary care, surgery centers, GI centers, because we want to be able to provide patients with help at every stage of their life. So I love the work that we do in the hospital, but I'm just as proud of the work that we do to keep people out of the hospital. And I think over the next few years, finding more ways to provide preventative care, to treat chronic disease, prevent those from progressing will be the biggest challenges for us.
Definitely agree.
Yeah. What is something that maybe you would like people to know about Texas Health Arlington Memorial that most people probably wouldn't know?
Well, I think a lot of people don't know that Arlington is such a big city, actually, and that Texas Health Arlington is not a sleepy little hospital. We're a 369-bed licensed facility, and we do just about everything there. So it is a community hospital, but it's a very sophisticated community hospital, and we have some amazing doctors that maybe you'd think of would be in a university faculty or elsewhere, but we've got them right there in Arlington.
I love it. Well, guys, man, this is
pretty good.
I learned a lot based on what you guys are doing, the amazing work. I know Vicki is also a part of the board, the Grand Prairie Chamber of Commerce. Does some amazing stuff on our board. So, Dr. Rockfield, I appreciate your time today, sir. Anything you want to close out with? Any other questions, B?
No, it's actually kind of reassuring to hear what you have going on at the facility. Don't take this wrong, but I don't want to see you guys anytime soon. So I'm a big believer in the preventive part of it because I think that there's a niche there. But more importantly, it's good to know that there's a fallback if something does happen. And being relatively new to the community, it was great to hear about all the services that you have at the hospital.
Well, I appreciated the opportunity to brag about the place I work at because it's an amazing place.
It sounds like it,
Yes,
man.
indeed.
Yeah, I was about to say if y'all hiring, but I didn't want to say no. I'm not qualified for the medical field anyway.
But you did stay at a Holiday Inn Express last night, right?
I did. But Dr. Rockfield, man, Vicky, I thank you guys so much, man, for being on this edition of Taking Care of Business with the Grand Prairie Chamber of Commerce with me and my friend, Mr. Co-host Brian Bondy, man. So thank you guys so much. We appreciate it.
Thank you very much. This was great.
All right.
Absolutely.
Thank you.
All right.